So hit me.
Hello and welcome to my channel. My name's Andrea if you're new here. If you're not, thank you for coming back. I am a lifestyle vlogger. I do what I eat in a day in my lives, and sometimes the trendy videos that are going around YouTube. And this is my second video in the series of pre-PA journey. My first video, which I will link here, is my full pre-PA timeline from late high school all the way till being accepted to PA school this year. And this is going to be the second video in my series where I have multiple videos coming on my pre-PA journey and more details into my application. But for today, we're going to talk about why exactly I chose to become a PA versus a doctor. I want to start off by saying that the reasons why I chose to become a PA might not necessarily be the reasons why you choose to become a PA or not become a PA. Everyone has to make the decision for themselves and has to take into account what they want out of life and what they want out of their career. I'm sure if you clicked on this video, you are aware of what exactly a PA is, but if you are not, a PA stands for physician assistant, and it's not exactly as the title suggests. Physician assistant is actually a professional healthcare provider who sees patients, treats them, diagnoses them, and is even able to prescribe medication. And they're able to do all of that under the supervision of a doctor. I think the PA profession is not very well known, even though it has been around for quite some time now. It still has a stigma and it's still not very well known. I'll give you myself, for example. I did not find out about the PA profession until about a few years ago. I had already been in school for 2.5 years before I found out about the PA profession, and I think that's very late into my educational career. I do wish I would have found out about the PA profession earlier, but it is what it is. I learned it when I did, and that's also another reason why I'm making this video, in case there's another person out there who is confused as to what each profession entails and is having a hard time making this decision. I personally think it was a very hard decision. I don't think it's a very straightforward decision for anybody. If it is a straightforward decision for you, I think that is wonderful, and I think you should really take value in that. But as someone who wasn't sure what healthcare profession I wanted to go into, I definitely had a lot of issues in trying to figure out what it was that I wanted to pursue. There are key differences that I'm going to go ahead and point out, and I'll be listing them here. Let's compare PA, which is physician assistant, to MD, which is doctor. PA, you have to do your bachelor's degree, so 4-year undergraduate and university, and the same thing for MD. So they both have that in common. PA school is 2 years, and to become a doctor, you need to go through 4 years of medical school. For PA, once you graduate, you can go right into your profession. For a doctor, you have to go into a residency before you can go into your field of choice. As a PA, you work autonomously, but not independently, versus doctor, where you work independently as well as autonomously. So in the doctor role, you are the leader. In a PA role, you are a supporting member. Another big difference between PA and MD is the lateral mobility that a PA has, and what that means is you don't have to go back to school in order to change a specialty. Let's say once you graduate from PA school, you want to start dermatology. You can do dermatology for as many years as you'd like, and if you get burnt out, you can go ahead and switch your specialty without going back to school. Versus as a doctor, once you're in residency, you do have to make that decision on what it is, what specialty you want to pursue, and once you pursue it, if you get burnt out, you'll probably have to go back to school in order to pursue another specialty. Another big difference between PA and MD is PA school is cheaper than MD school. They're both pretty expensive, but PA school, since it is 2 years, is cheaper than medical school. And considering that you are not the leader and you are more of a supporting role, being a PA, your salary is less than a doctor. Well, I think one of the hardest things to get over when making this decision for me personally, I wanted to be referred to as Dr. Andrea. There is a pride that comes with the title. But when I kept thinking about the 4 years and more that is going into medical school, there had to be a reason why I was pushing myself along the way through those years. And it could not just have been for a title. I knew that if I was doing something for the title, at the end of the day, I would not be happy. I was already a first-generation college student. I had brought myself all the way to the end of my bachelor's degree. I brought myself this far. I committed my time and I committed my education towards becoming the best that I possibly could be. And to me, that meant receiving the title of doctor, no matter what it took. But at the end of the day, I needed to be comfortable and happy with the idea of I'm not living to work. I am working to live. I don't want to make my job my everything. I don't want to not be able to spend time with my family or my loved ones because the predicament of, oh, I can't spend time with my family, I can't spend time with my friends because I am at the office or in surgery, or I had to stay here longer because I needed to get something else over with. There are PAs who have to do that. I don't want the responsibility of being the leader. I know I could handle being the leader. I know I can handle the responsibility. It's just not what I want. I know that what I want is to see patients and treat patients and be able to have that patient-provider interaction and solve problems and learn from my everyday interactions. And I know that being a PA encompasses all of that. Having the title PA is exciting and invigorating, and I'm excited to tell the world that I will get to be a physician assistant. I think when it comes to deciding whether or not to become a PA, I really do believe that the ego is the hardest part to get over. There's a lot of pride associated with saying, oh, I am a doctor, as there should be. But I don't think that's the only thing to be prideful for. There are other healthcare professions out there that involve with saving lives and are just as involved as a doctor. And PA is one of them. So that was pretty much my whole process of figuring out whether I wanted to be a doctor or a PA. And it wasn't an easy decision, as I mentioned in the beginning. And as you can see through my entire conversation, it was difficult. There were a lot of parts to it. And ultimately, I made my decision. And I could not be more enthusiastic and more proud of the decision that I made. I go to sleep every night comfortable and confident with my decision and happy. I do want to admit that the second I decided to become a PA and let go of that ego that told me I had to become a doctor, I felt a sense of relief. I felt a weight off my shoulder. I felt like I could finally focus on becoming who I wanted to be exactly in the way that I wanted to do it, and that is become the best healthcare provider that I possibly can be. I ultimately ended up learning that the PA profession is a groundbreaking career. Still a lot of people don't know about it, but that's where I come into play, where it is my job to spread awareness. It is our jobs as PAs, as healthcare providers, as doctors, as nurses, as nurse practitioners. Everybody has to spread the word about these healthcare providers and allow people to understand that they are just as qualified to handle patients. I want to be part of that growing field. I want to help spread awareness as much as possible of the PA profession. I hope you enjoyed this video, and I really hope it was helpful to you in any way possible. Even in the slightest. It was a very difficult decision, and I know a lot of people are probably going through that same difficult decision, which is probably why you clicked on this video. And I hope giving you my insight will help you look into the reasons why you will choose and ultimately make your own decision. I'm just gonna end it on, listen to yourself. Talk with yourself, have this conversation with yourself, and ask yourself, what is gonna make me happy at the end of the day? How am I going to help the most people I possibly can while also maintaining my mental health? And with that, I'll see you in the next PA video. Within the next few weeks, I'll be posting my CASPA application process as well as my CASPA stats. So please stay connected. Go ahead and subscribe. If you did like this video, please hit the like button and comment any questions that you have, and I can address them whenever available and potentially in further videos. Thank you so much. See you in the next one.